And just let me know if you can no longer hear the audio from this presentation, but it is attached to the slides. So hopefully you will be able to hear as we go through the slides.
Embedding trauma-informed approaches at Providence House. Speakers are Colin Field, Lindsay Johnson, Mary Neesey, Sophie Lemon, and Che Roseberth. Why we did the project. People who have experienced homelessness are much more likely than the general population to have experienced trauma, and being homeless can be a traumatizing experience. Providence Row were asked to consider undertaking this pilot from Public Health, and we would really like to thank them for giving us this opportunity. Our 8-month pilot aimed to embed awareness of trauma-informed approaches and a process for co-producing quality improvement in Providence House, which is a 33-resident hostel for single adults. So the staff and residents were equipped to continue making the hostel more trauma-informed.
This was a joint project with East London Foundation Trust, and at the start of the work, a psychologist and an assistant psychologist interviewed 11 residents and 9 staff around the themes from a trauma-informed approach about how they thought Providence House was and what they would like to see happen. And so we asked questions around safety, trust, being understood, being empowered, and well-being. The themes within those responses are seen here. In summary, residents and staff highlighted many things that were working well in the hostel, including supportive management and staff and effective safety procedures. They also highlighted opportunities to improve, including relationships between residents and between residents and staff, improving digital inclusion, access to support outside of the hostel as well as in reach, and communication between residents, the hostel staff and the wider organisation at PRHA.
We held 6 workshops for staff and residents. More than half of residents took part in the workshops. We used an iterative approach. Then we held a second round of workshops after 3 months to update on progress and choose the next step of change ideas to focus on. There were options for residents to suggest ideas and for them to vote individually for those unable to attend a workshop. Staff monitored and gathered feedback from residents on the change ideas as they were implemented using a Plan, Do, Study, Act model.
Under safety, we had 5 themes that we concentrated on: staff teamwork, policies and procedures, staff skills and training, antisocial behaviour and aggression, and drug and alcohol use. From the workshops, staff and residents suggested the priority should be given to trauma-informed training for staff, a window in the laundry room door, safer neighbourhoods teams to visit more frequently, and for reset workshops to take place at the hostel.
There were 3 themes that we identified under trust. They were staff support for residents, shared activities, and relationships between residents. Residents and staff identified the following priorities: outings away from the hostel, joint cooking and food sessions, puzzles and games, and mediation for residents who have conflicts.
When looking at being understood, we had 3 themes that we focused on: staff approach to engaging with residents, relationship between staff, and cultural and social diversity. The residents and staff suggested that we need to have communication and sensitivity training for the staff, that we make information available about local places of worship and faith groups, and that we have celebrations for different religious and cultural festivals.
Under empowerment, there were 5 themes. The themes were support for resident independence, staff empowerment, open and effective communication, impact of the wider system, and resident involvement in how the hostel runs. The change ideas were improving Wi-Fi access at the hostel, digital skills training for residents, a guide to the local area and to the hostel for residents when they move in, a feedback and suggestions box, Providence Row Housing Association reviewing how it gathers and acts and shares on resident feedback, having a resident representative, more regular residents meetings, and a co-production policy to support residents being involved in projects at the hostel and at PRHA.
When looking at well-being, there were 4 themes that we focused on: support for staff, physical environment, access to healthcare for residents, and the impact of COVID-19 on the residents. The residents and staff suggested that we have reflective practice sessions for the staff, that we get new furniture for the lounge to make it more of a homely environment, that we have a choice of bedding available for when the residents move in, and for staff to build stronger relationships with the local GP practice, for example, taking part in MDT meetings.
The process of doing the work was new, working as a staff and resident project team on service development. We were very fortunate that 2 residents were involved in the project team. Other residents were consulted on an ad hoc basis, for example, on the communication materials. Linked to this project, the organisation developed a co-production policy with residents and staff, and an online platform and governance for sharing information equally with residents and staff. Many informal conversations were held with residents and staff, and we spent a lot of time knocking on residents' doors. There was written communications, which included a fabulous newsletter. There were posters advertising the project and the activities. There was a project notice board in the lounge and a digital screen, which had lots of updates. There was residents' meetings, and our key workers were continually talking to residents about the project.
A resident project team member said, "What a huge privilege it is to be part of a team taking action to make change in hostel living and care for residents. It has not just helped me improve my own mindset, but also the people I interact with, spreading a more positive outlook on how I view my environment and the people within them. I have gained many skills and knowledge that I can now go forth and implement into my own life, and I'm truly grateful for the opportunity to make change." A staff project team member said, "The residents were so happy after both change idea workshops. Multiple residents who attended told staff members all about it and how they enjoyed the experience. It was really energizing to see so many residents engage and be passionate about the topics and themes."
Go.
Example of impact. Staff have reported that using games has helped their relationships, assessments and support planning with residents. Playing music during activities has led to residents sharing memories associated with music and opened up richer conversations between staff and residents. Attendance at weekly shared food sessions with staff and residents has steadily increased, and more residents have become involved in choosing and cooking dishes. Workshops for staff and residents have engaged residents previously reluctant to discuss their substance use. Staff have learnt a lot from hearing residents' experiences, and this deepens their understanding of how to support people. Improving Wi-Fi access and digital skills have become a priority for the organisation, and links have been built with community organisations that are supporting with this increase in average scores from 286 to 320.
The staff member said, I found playing games very useful in establishing a good rapport with the residents. Prior to the introduction of the initiative, it was quite hard to get hold of certain residents and keep a conversation going for a while, but playing games opened up that room that led to having meaningful discussions. One of the residents said, I was happy to see the effort being made with the barbecue. It was nice to see the other residents there too. A reset worker said, it's been a great experience as the substance use workshops have been with staff and clients. I have felt that this combination worked really well as staff have learned from the clients' experiences and given them valuable insight into addiction. It's been very easy to deliver as everyone got involved.
What helped with this project was taking time to build relationships, the co-production and offering range of opportunities for residents to be involved, the consistency and perseverance when introducing changes, the weekly input of senior managers and ELF partners, using the Plan, Do, Study, Act approach, and the funding for the project, which enabled backfill, was crucial to get the project started. There were some constraints and challenges of doing this work. One is always going to be about staff turnover and ensuring that the project continues to be led well. With staff retention, pay definitely needs to be addressed to attract and retain staff. People will use their newfound skills and take them elsewhere. Working with multiple agencies and partners, it does take time to build relationships in order for actions to be implemented.
What we would like to happen next, we'd like even more resident and staff involvement, making sure that each new resident knows about this trauma-informed work and how to take part. Continuing to introduce new change ideas and involve residents and staff in ongoing quality improvement. Continuing to develop relationships with different services, and co-production and additional staff time to be funded as part of the contract for the service.
Perfect. So thank you very much, Angela. I'm delighted that it actually worked and that you got to hear some of the participants that really made this project the success it is. So I suppose really as a start off, I mean, would anybody like to ask any questions? We've kind of allowed like 10 minutes if people want questions, or then we have some questions to maybe give to you. But does anybody have any questions you'd like to ask Simon or myself? She unfortunately gives her apologies for today. She's unfortunately on study leave. but this project and Sarah, who worked with her, were invaluable to us in making a real success of the project and actually challenging us to make a difference. I see some hands up. So Sarah Mosley.
Hi, it sounds really great. And I was interested in lots of things, but one of them I was wondering a bit more about the Plan, Do, Study, Act. I mean, is it just like as it says, or is it, how did that work?
It was absolutely amazing. It was a model that got introduced to us by Che and Sarah, and it was part of the quality improvement. And when we were working with the residents to set up the change ideas, I think it was quite interesting how things took a lot longer than we had initially planned. So that was a real learning for us, that even doing something really simple actually took a lot longer than we ever would have envisaged. And also we realized, so for example, we mentioned there about the laundry. When we started this pilot, the women wanted their own space in the laundry, a time that was specific for women. And then when we tried to implement it, they were saying they didn't want that anymore. The Plan, Do, Study, Act model meant that we had a plan and we tried to do it, but then the ladies in the project felt safer and didn't feel they needed it anymore. That was fine, but we still then looked to do something to make them feel safer, not what they had initially said. So it meant that even if you planned something and as you were working towards doing it, that it wasn't working, it was okay to say, okay, this isn't working, we're going to try something else. It was so simple and it was so effective. And the thing is, the residents always felt included. So when we were making these decisions, everything again was consulted with the residents, and they would agree with us, well, actually, no, we don't want this, we'll do that. And we were able to change it. And that actually took a lot of pressure off the staff. So I hope that kind of explains it. There is, I know we have some information on the Plan, Do, Study Act, which I'm sure when Che comes back that we'll be happy to share with everybody.
That's great. Thanks. Yeah, no, thank you so much. That's really great. And it's yeah, kind of a model that you're reflecting a lot and listening to what people want. And like you say, if something doesn't work, just you try something else and realize it's not quite the right thing. It's really great.
Absolutely. I think Simon was going to make a comment, and then I come to the others, to Graham. Simon.
Yeah, I was just going to say it's a way of keeping things quite simple, really. Identifying a small change that you can you all agree that needs to be made, making that change and seeing whether it improves the situation. So studying it. And then really just sort of an iterative thing of small steps of improvement, building on quality that way. So you're not sort of going for some great monolithic 10-year plan. It's something which you can turn around quite quickly. And the nice thing about this approach is that it keeps the engagements of the residents. You're not tying them down with process. You're not tying them down with bureaucracy. You're not tying them down by having to wait for funding and grants to come through. It's something you can afford. It's something you can often do for free. It's just a change of procedure. It's a change of the way interactions happen or something like that. And yeah, it's as Mary said, it is something which can be quite exciting because it's something which in truth you're probably doing already every day, but you're not recognizing and you're not building on in that concrete way and celebrating at the end. And it's the way you build good services and quality. So yeah, recommend it. And it's all thanks to ELF. So we attended the ELF quality improvement training, and it came out of that. So thank you.
Graham.
Yes, I'd just like to ask, how long are the residents with you?
Sorry, how long?
How long are the residents with you?
Okay, so the residents of Providence House can be with us anything, well, some of them are up to 2 years, and some of them actually have got tenancies that mean that they're there for life. Our big struggle, though, was with COVID. When we unfortunately went through COVID, resident engagement went down. They were too scared to come out of their rooms. And that was a big challenge for us when we took on the pilot, was how we would look to get residents to come back out of the room. So even though some of them had been with us quite a while, a lot of them were too scared to come out. So some of the activities that we mentioned, like the games, having the music in the background, they all grew. They kind of grew because of the residents' suggestions. So we started off doing games. In the beginning, no residents would come to the games, but we said for the staff to go out there to do the games, regardless of whether a resident would show up, to show that we were committed to it. And then the residents started to kind of come down, they play a game, they might come back. There was one story which we loved for one gentleman. He would not engage, no matter what you did with him, he would not engage. And one day he decided he would actually sit down and play a game, but he still wouldn't talk. So the worker decided she was going to cheat, and he caught her. And he told her she can't do that. So she pretended she didn't know the rules of the games and asked him to teach her how to do it properly. And all of a sudden they started talking, and it just opened so many doors to people that no matter, a lot of the things that we tried beforehand hadn't got the success we had wanted. And the beautiful thing about it was so easy. We'd get the games from the charity shops. When I love jigsaw puzzles, so when I do my jigsaw puzzles, I bring them all into Providence House. And it's just so simple. I think that was the beauty of it. The things we did, they weren't huge. They were so simple, but the impact was just outstanding. Does that answer your frame?
Yes, and it's also like, because it was going to be just to say where you'd said about staff retention on the slides, I was wondering maybe training some of the residents, because if they are with you for a long time, and then that way it's building up their self-esteem, their skills, but also maybe asking the residents what sort of skills they've got, like life skills or what trade they used to do, because then maybe they could actually teach other people as well. So that could be an idea.
Well, they've taken over the managing of the barbecue. They tend to do the barbecue, which is, we oversee it, they do it. And there's one resident also who's really interested in history, and we're trying to see if we can get a way to share the local history. So there's lots of really interesting things coming out of it. I'm mindful there's a few hands. So Farid,
sorry, Mary, I was just going to say.
Sorry, Simon.
I was just going to say that, of course, one in the actual project team, there was a resident who took charge of the IT side of it, and how we were going to share information between the organisation and the residents and the digital assets. He wrote sort of user guides and what have you. So he was very much involved in that, and he demonstrated his skills superbly. So yeah, we had sort of taken that approach as well.
Thank you, Simon. Farid.
Yeah, no, just wanted to say excellent presentation, and lovely to hear a positive outcome. Just wanted to ask a question. Were there any challenges from staff in implementing the trauma-informed practice initially?
Well, yes, I suppose there was. I mean, the brilliant thing was that there was training. So there was training both from ELFT and from WAVE that also came via public health. So there was training there for staff, which definitely supported them. I think what was challenging, if you like, was staff didn't think they were doing their jobs if they were sitting out playing games, which, we had to kind of say, look, you're all wanting to get better relationships with your residents. it's how you do it. It wasn't really anything extra they had to do. It was just changing how they were building the relationships. And the one thing I would say, there has to be commitment from the organization. So you have to have leadership and buy-in from the top, cascaded down, because with our staff, they wear lots of different hats. And, you know, if they get called on, as far as we're concerned, the residents are the priority in how we work with our residents. So, of course, we need to make sure that they're not called away. And I have to admit, that's where the additional support for staffing to get cover really made the difference for this. So, yeah, I hope that answers your question. Does that, Farad? Yeah, lovely. Thank you.
Can I just, sorry, can I just give
Simon,
a big hand to Sarah, the psychologist, because she was just astonishing. You know, she, I think it's really key to have a professional who is really on it, involved in this kind of project. Her commitment and her productivity was amazing. I think everybody who had anything to do with her was just blown away by her abilities. And I think from the perspective of the staff, it's really good to have that sort of bedrock there. When you're in an environment where you are changing the way you work and you're changing the way you relate to your residents and what have you, it can be slightly unnerving. You can be asking yourself, what's going on here? How is this supposed to work? And having someone like Sarah there to underpin the process and to reiterate what you're doing makes so much difference. So I think she was fabulous. Thank you very much.
Thanks, Simon. I agree. Desley.
Thanks, Mary. Yeah, no, absolutely fantastic piece of work. So congratulations to all involved. I was really interested, Mary, in you talking about the games, because I think since I came to the borough, I wanted to have a meet the commissioner playing games session kind of once a month with them. And the reason being is that, you know, a lot of our clients have not had a good experience with authority. You know, we are the people that enforce the rules, etc. So I think the games is a great way to break down those barriers. Do you feel like you gave an example of the gentleman who picked up on the cheating? Do you think it's had a long-lasting effect in the relationship between residents and workers in building the trust?
I would say the trust is the core of everything, you know, in the sense that in some ways, no matter how you try to be in a hostel, the support workers still have to lay down rules and regulations. So sometimes there can be a bit of conflict in trying to build that trust and support. And definitely doing the jigsaws and doing the games really, I think it builds that trust. We talk about building the trust bank, and the key thing was that we were consistent about it. Then one of the workers decided that they would bake some cakes and have them when they were doing the games. But then the next thing, the residents were saying, well, can we cook this? So all of a sudden, it kind of grew from this tiny thing of playing a game to some people cooking in the kitchen for the people who were playing the games. And then another time, we unfortunately had a resident that passed away, and he had decided to get some music together that he would like played. And at one of the sessions, we decided to play his music, and the residents all loved it. And the staff also realized that sometimes silence was the hardest thing to deal with, that people felt that even when playing games, you had to talk, but of course you don't. And when they put the music on, it actually filled the silence, and it made everything so much more homely. And everybody commented on it. People who came in commented on it. And again, it didn't cost to being. It was, you know, it was wonderful. It really was. Thank you, Desley. Angela.
Hi, thank you. I just wanted to make sure that we got to Mina's comments or questions in the chat. There's two, so I can just read them out if that's okay. One is, in terms of resident involvement, was it done through people participation in ELFT, or were they otherwise compensated for their time? And then her other question is, what role did training play in making things more trauma informed?
Lovely. Tamina, thank you very much. So yes, there was definitely there was vouchers given for all of the residents who were involved, and they were mainly involved, the residents that were based in Providence House. We had the one resident that was outside Providence House was a resident that Simon mentioned earlier, who was at the time based at the Dello, and who was very, very supportive in looking at platforms to support sharing of information between residents and staff. So yes, they were paid. Just to say then, in regards to the training, definitely the trauma-informed training, both the WAVE training and the training provided by ELFT was recognised as being very successful and very supportive to the staff. I think the one from ELFT, a lot of our staff really loved the interaction and the examples that were shown. And we are hoping that, please God, when Chick comes back, that there may be some more of those sessions, because we still have some funds left, and a lot of people have expressed interest, so there might be some more possibilities. I know that hopefully John Fortune and the neighbourhood teams are wanting to come on the training, so that would be good. Lovely. Is that okay, Tamina? Patricia.
Thank you. I just really want to say a huge thank you for sharing this experience, this journey that you've been on. I've been hearing about it from Shay regularly, but I tend to hear the kind of challenges. So it's really lovely to see the product, the kind of the changes that have been made. And what I think is really amazing about what you've shared with us is actually what trauma-informed approaches can do. And there isn't a whiff of let's talk about your trauma in that. And I think there's often a misunderstanding about what trauma-informed care or trauma-informed approaches are. It's just, I think that all of the ideas that you've come up with are absolutely infused with the starting point of understanding someone's journey, and what's happened to them in the past will affect how they are in the present. I know you and I are meeting, Mary, and I'm going to sort of think about what else we can do to really use this to promote the approaches and share the learning. I do have a question I'm getting to, but I just really, I think it's fantastic work. I guess you keep touching on it, and the question I think we often come back to is, how are we going to make this sustainable? Not just, I think if you just carried on doing the changes that you've made, that will make a huge difference to the lives and experience both of your staff and your residents. But I noticed there were quite a lot of change ideas that you noted you haven't started on yet, and I'm just two bits. I think what plans do you have, and also thinking about how we can continue our partnership to support you.
Lovely. Thanks. So yeah, we were very lucky that we got 3 of our staff onto the quality improvement leadership training. That has been invaluable, because sometimes in the hostels we don't seem to get the same type of information, perhaps cascaded in a way that we were fortunate to get while part of this project. And even those, again, some of those areas were very simple, you know, like the Plan, Do, Study, Act, like the change driver diagram, which we couldn't get over how excited the residents were by the change driver diagram. So they will be things that we will continue to use, both for the current change ideas and to develop new change ideas. Those of us, the core people that were part of the group, we're continuing to meet. So one of the things that also, given that the pilot was quite short, one of the things that made this a success, even though we thought in the beginning would be too much time commitment, was that it met weekly. So at the moment, we're meeting every second week to make sure that it continues. The games, I think the other big thing is about culture. So whatever you're trying to do, really what you're doing is you're changing the culture of the way you work, so that the new things you do become your way of working. The games and the activities are here to stay. I think people would be just so upset if they went anywhere. And then we have a core group at Providence House who are continuing to look at change ideas. Like even the work with recess, we just got some fabulous feedback, and Denton, who came out to facilitate those sessions, was also, I mean, he gave a comment as well for the slide. Those things, you know, again, if people can commit to them, we will continue, if not to deliver them all the time, we might do them like maybe every few months with the agreement of Vicky and her team. But what was so interesting was how people opened up. And for me, it broke down a lot of the barriers that that perception between staff and residents. And it was a very much, they're all in it together. And that is still continuing, even though that the pilot has kind of now finished for a few weeks. Simon, I don't know if there's anything you'd like to add. Not putting you on the spot or anything.
Yeah, I think, you know, Mary's right. The way that this thing sustains is significantly by cultural change, and part of the cultural change that we're talking about here is giving some authority and responsibility to the residents. That is an interesting process, and you know, I think once you've negotiated that process, it's something which seems to have more in terms of legs to sustain itself, because the people who have assumed the responsibilities and authority tend to run with them. And that, as I said, is interesting. Sometimes it can be quite challenging for the team for a number of different reasons, and it could, simply because it challenges sort of, you know, what is the presumed natural authority, line of authority within a service. But I think at the same time it's very refreshing, and yeah, I think it empowers a lot of the people who maybe would have been sitting frustrated in the past. So we have you know, a lot of initiatives which involve residents actually taking the lead in delivering things with support, rather than staff being supported by residents. And I think it's an important distinction, turning it on its head. And if we can sustain that kind of culture, I think we can sustain this approach, and we can sustain the improvement.
Thank you, Simon. Charlotte.
Hi, thank you. That's so interesting and inspiring. I think I'm not sure if this is going to be a question, because I think you've covered lots of it in your other responses, but the one thing that really struck me when you're talking about games, and especially the making cake to equal the games, is the playful nature of it. And that perhaps, you know, when we're talking about trauma-informed practice, we're not thinking about how adults need as much as children do to play. And the residents need to play and the staff need to play, because playing is part of being human, actually. And so I'm curious about how that will move on, and what other playful experiences and other ways of satisfying people's curiosity about how things work and making things and doing things will continue. And I was thinking about the possibility of other creative activities going on with the cake and the music as well. So it was just kind of it's a vague question about how do you see that moving on, or how do residents, more to the point, see that moving on?
Yeah, I don't think it's ever going to stop. I think what we did was we pushed some big kind of bookcases out in the lounge area, so that any resident can come down and pick up the games and play them anytime. They don't have to do them in the lounge area. They can take them to the room, but if they do that, they're engaging with somebody else. One of the things that we noticed was there was some of our residents that were very isolated, like no matter what you would try and do, they didn't want to engage or partake. But some of those have actually started to make friends with the individuals they play the games with. And again, of course, having friends as opposed to just being in a community of other like people was so important. And maybe our biggest task really is to try and keep an eye on the games, because they kind of disappear, not because they're stolen, but because they're being used. And then when you try to do your activity on the Wednesday, so Wednesday is our activity day, really. It was one of the days that staff and residents found to be the best. And then, like all of a sudden, it's kind of, yeah, it's escalated, but it's wonderful. And we try to get some of the big cases to do the jigsaws in, so people can move them around or take them to their rooms, or, you know, so that if they want to do it in private, they can. But if they want to do it, you know, so having them transferable. So there's quite a bit of thought went into it by the staff. And what is interesting is that the residents are saying now, oh, can you get hold of this game? I remember this game when we were younger. And the staff now are just kind of looking on the internet sometimes, trying to find, can you still get hold of this game? I tell them all to go down to charity shops. It's a haven for games, pre-loved games and jigsaws. And then if they go missing or whatever, it doesn't matter. So I think it's just trying to make sure we have enough games to keep them all going. And yeah, the activities really, they come in, they ask now to either make pizzas, or, you know, it's not just like cakes or whatever. Sometimes they want to do a curry, because there'll be certain people who want curry, and they vote on it. They'll say, okay, well, we'll do this next week. And we also support them to try and go out and get the ingredients. So there's a lot of learning that has happened, or skills that we were hoping that we could get them to take on board, that we weren't quite and get there before. But now they're doing it without even thinking that they're doing it, which is wonderful. So yeah, I hope that kind of answers your query, Charlotte.
It does, and Mina's just put in the chat the thing I was going to say, so that maybe they could make their own games, which is definitely something that, as you know, within our early years, which is my background, we would be doing all the time, is getting children to create their own games.
Yeah, it's wonderful,
and it's such fun. No, it's great. Thank you.
It is. Yeah, my staff are becoming experts. So I can't play with them anymore. Sarah Halsey.
Hello. Yeah, first of all, just like, it is really inspiring to hear about this project, and like really fascinating. So yeah, thank you for sharing your presentation and your experience. I just wanted to ask about, at the end of the presentation, it was mentioned about residents' WEMWBS score, and I just wanted to ask, well, yeah, I don't know what, I've never heard of that before. I was just curious about what that is.
Okay, so that was the Warwick assessment tool, and bless him, Colin, who was one of the residents who supported us, and who was speaking. There were certain words that, bless him, he couldn't say, so we told him it was okay to leave them out. But yeah, so that was an assessment tool that we undertook, and what the whole aim of this really was to try and improve the health and well-being for our residents. And what was very interesting was that Che and Sarah took a lead in doing those assessments, because we felt that if our staff had undertaken them, that the residents might be more inclined to say maybe what they thought the staff wanted to hear.
Yeah.
The other thing that came out of doing it was a big discussion around the language that we used. So we became very mindful that if we were saying things like, oh, we have an assessment or we want to interview you, that wasn't working very well. So what we said we would do, and we used to have, we used to have weekly meetings, and you think it was mad, the things we were talking about. But we actually decided to say we were going to have a conversation with them. It completely changed the responses we got, because now you were having a conversation, they could say what they liked. They didn't think they had to say something that you would want to hear. It made such a big difference. And then the WinWeb was undertaken again towards the end of the pilot. Again, there was, as you've seen, there was a slight increase. It wasn't, and Che was much better in being able to tell about what was significant and what wasn't significant. But the thing is, with a small period of time, we did get an increase in the residents' well-being. And definitely the atmosphere, not that it was particularly bad in Providence House, it wasn't. But the thing is, following COVID, things were more challenging around engagement. And it was just that thing that broke the ice and got people to come back out and start mixing and participating. And it was wonderful.
Yeah. Oh, that's great. I'll look that up. Thanks very much. Thank you.
Okay. Lovely, thank you. Julie.
Hi Mary, thank you for sharing. What I wanted to know is if you could rewind and go back to the start of this project, would you change the way that you went into it or you started delivering it?
It's an excellent question. I don't think so, because
I was going to say, Mary, it would be tempting to say things like, some of the things which took a bit of time, which was things like agreeing the co-production policy procedure, which at the time it felt like it was an impediment to progress, because we were trying to work out how this was going to work and get an agreement across the organisation. Of course, that involves the sort of highest level of management and what have you. So they had to go, run up and down the ladder and what have you. Having said that, the residents were involved in that whole process, and so that actually the project team was involved in that process, and maybe they're even then developing and understanding the policies and procedures at the beginning is actually an important part of it as well. So I think rather than coming to the table with a sort of package which we say this is how it's going to work, it was actually kind of interesting to have the whole thing actually done from scratch with the residents involved. So I'd say, get the residents involved right at the beginning and then work out what you're doing, rather than work out what you're doing and then get the residents involved. It's a more interesting process.
Yeah, and I think the only thing I really would add was that I think the training was brilliant, because it gave staff, the understanding and some tools which they could use. But I think Simon mentioned before, for us having that opportunity to work with ELFT and to have like Sarah, so staff could maybe have the trauma. And I think one of the learnings that came up sometimes was how do you support staff to implement what they learn when on training? That is not that easy. If perhaps I think it was in the feedback at the last meeting, was how do you support that? If the managers weren't there, staff may not feel comfortable to bring back the learning to the team and to be able to do that. I think what was really fortunate for us was that we did have Che and Sarah, and they came in almost every Wednesday. And what was interesting was it was almost lead by example. So Sarah had certain approaches, and our staff were able to use them because they were so easy. It was just a case of how you do them. And so staff were able to watch what she did, and then use what she did, because she always involved them. And of course, we had staff that were committed to doing this pilot. So they actually learned a lot more, I think, through watching and participating and learning. And as a consequence, it has become part of the culture for Providence House. What I'd love to do is replicate it in our other projects, but I haven't got a Sarah. I need to make a Sarah somehow. I don't know if that helps, Julie.
Yeah, thank you.
Lovely. Thank you. I think, is that all the questions?
That's it. Only all those ones.
Wow.
Thank you
Okay.
so much, Mary. Clearly it's been a lot of really useful learning, and I'm just really pleased to hear that it's continuing, and that you'll have more to learn as you go with,
Yeah.
With the PDSA model. I wonder if we can, I guess, go to Patricia.
Thank you. I wonder if sorry, I wonder if I could be cheeky and ask if you would be prepared to come back and present to the community, or give us an update in the community of practice in maybe 6 months or 8 months, you know, because I think the points that you make about it's an ongoing process, it's a changing culture, and you know, we so often think about, you know, we deliver training as if that's the job, if that's the task, and the translating training into learning and then into a change in behavior and culture takes time. And I think it would be great, because I'm sure there'll be all sorts of other learnings that you'll be able to share with us, if we could maybe schedule to come back next summer to present an update.
Yeah, I think we can do that, can't we, Simon?
Yeah.
And maybe we'll try and get a time when Lindsay, who in fairness is a brilliant. We had Cindy, who overseen the project when it started, and then Cindy unfortunately got another position. And Lindsay is there at the moment, who is also very much bought into the new culture. And I think that to us, we thought might have been a challenge. But actually, the team were already so involved. Basically, she was brought with it, and it has worked really, really well, and continues to do so. Absolutely, I'd be very happy to come back and to feedback and update.
Lovely, thank you.
Lovely.
Thank you.
Yeah.
That's great.
That's okay. We did kind of have, I don't know what people might want to do. I mean, we did kind of, we were talking about whether we would have a breakout group, and we had some like questions that maybe we could look at, whether it was around like barriers of communication and solutions. But I don't know, maybe if there is anything particular anybody would like to hear a little bit more about, or have a little bit of brainstorming. Yeah, it's kind of over to you, really.
I can put the questions that Mary had prepared in the chat, but I wanted to check with Patricia just around whether you still wanted to have a quick discussion about the upcoming session in November, just because I'm aware that we've got around 8 minutes left. You're on mute, sorry.
If that would be okay, Mary and Simon, if we could take a little bit of time just to talk about the next community practice. So there are some ideas that we wanted to test in this space. Is that all right?
That's absolutely fine.
Yeah.
I think people ask lots of questions.
Yeah.
And again, if anybody, you know, through Angela or Patricia, if you want to remain in contact, or you want to ask something specifically, or you might like to come and see Providence House, we want to come and play a game on a Wednesday. Yeah.
That's
Thanks,
incredible.
Patricia.
Incredibly generous. I'm sure lots of people will want to take you up on that. And I know that you are members of the community of practice, so you'll be regularly with us, hopefully, so people can kind of check in with you. What we wondered was whether there was an appetite in this group and whether it felt safe enough to take some time to reflect on our own experiences of delivering services at a time of hardship, really, that we're all being affected by. I'm struggling to say the cost of living crisis, but I'm going to use that phrase because it's so around in the media. But the cost of living crisis affects the people who use our services. It's going to have a knock-on effect on the commissioning of our services, and I don't know, maybe you're already having conversations about how are we as an organisation going to make sure we're efficient. But it also affects us as individuals, as citizens, as residents. And one of the key parts of trauma-informed approaches is looking towards the people who provide services, our people, our staff, and making sure that they are safe and well supported. So in the spirit of that, rather than having a presentation about what fantastic work that's happening, we wondered if people would like an opportunity to reflect on these sorts of challenges, or whether it feels like this isn't the right space to do it, because it is an open space and it's not like we all know each other very well. So yeah, I just throw that out to see if there's an appetite for that or not. And it's perfectly fine, to actually know we're doing that elsewhere. We don't want to be talking about those things. But I think it's as much about looking after ourselves as looking after other people. I think that's a very key part to trauma-informed approaches, and I think it ran through your work in Providence Row. So, yeah. Happy to be shot down and no, or Mary, thank you. I should say I've silenced everybody.
Yeah. I would say that in the hostel sector, definitely it is huge for us. Recruitment is an ongoing challenge. We are finding it very difficult to get and retain staff. Unfortunately, in our sector, the salaries aren't brilliant, and I think Che mentioned it too in the presentation. That when staff get some new skills, other organisations want those skills so they can get a better paid job quite quickly elsewhere. So that is a big challenge. I know in the hostels too, we're finding a lot of our contractors are all trying to add 20% at least to their, to the tendered prices, and that is not in our budget. And every time we try to look at that, something has to go, and usually the other big expenditure is staff. So yeah, there is. I probably would welcome something. We definitely have challenges, and we don't have all the answers. And we're just looking at efficiency savings at the moment to see where we can do that and what budgets we can freeze at the moment. So yeah, it's a challenge.
Yeah, and I think we were thinking, obviously, we don't have any solutions, and we certainly don't have a pot of money that we can hand out. But I think it's having a space to think about what does it mean for us personally, who've come into the work that we do to try and help people, and then we're having to make these very hard decisions. So it's really a kind of space to kind of think about the impact that having to do all of these things has on us, and how we are able to keep coming in and doing what we do. compassionately and under very difficult circumstances. So we weren't thinking of a sort of like, oh, you know, we managed to save £150 by, you know, kind of going to, I don't know, own brown coffee or whatever, but much more about, actually I find it really difficult having to say to residents, now we're not going to be able to buy a new game, because what does that feel like to be in that situation? That's the kind of thing that we were wondering about. Charlotte?
Yeah, it sounds like quite a good idea, really, because it is quite necessary to share this stuff. And I suppose it depends, you know, because it makes you feel quite vulnerable to kind of have to talk about how difficult it is, you know, whether at the time then the people who want to come, well, we might have a smaller group perhaps, in which case it might be a bit easier in some ways. I think that yes, thinking about how you maintain resourcefulness and creativity in the face of feeling everything is being pinched and squashed, would be quite useful if we can kind of give it some sort of boundary like that in a way. I don't know.
Yeah. Okay. I think yes, we'll do some work. Well, I think it's the steering group can have a think about how we frame it and contain it to ensure that it feels like a safe space and that people are clear about what the focus and the purpose would be. And then absolutely, I think people can choose to come if they feel like it, as with every session actually. If people feel like that would be helpful, and if it feels like that's not for me, that's also okay, that people can skip the next one and join the following one. Does that sound like a plan? Yeah. Okay. Thank you very much. And again, thank you to everyone at Providence Row and Providence House for sharing truly amazing work. I think we need to find a way of promoting this beyond this space if you're up for it. I've got a few ideas.